The fatal surgical incident of 5-month-old Su Luoxi in Ningbo, November 11 to morning of November 15. Background and initial diagnosis, November 11, 2025. The incident began on November 11, 2025. Since Luoxi was born prematurely, we took her to the Ningbo Women and Children's Hospital for regular checkups, growth monitoring, and GMS, general movements assessment, tests. We spent several hundred yuan each time on GMS tests and motor skill tutorials. We wanted her to grow up healthy and never hesitated to follow medical advice. After she passed all her routine checkups at 3 and 4 months old, Dr. Gao Yongjia from the high-risk premature department suggested we get a cardiac ultrasound, a brain CT, and a hearing test. He insisted these were mandatory for premature babies, and we agreed. During the cardiac ultrasound, 3 different technicians examined her over the course of 40 minutes before they could even reach a tentative diagnosis. They seemed uncertain when we asked what was wrong, but their expressions and the length of the exam made us deeply uneasy. They told us not to worry and referred us to a specialist. We immediately made an appointment with Dr. Chen Junxian, the chief of pediatric cardiac surgery. However, when we arrived, we were seen by Dr. Yu Qingzhong instead. He spent barely a minute glancing at the ultrasound report without ever looking up, then immediately demanded surgery. He claimed she had 3 mm and 7 mm atrial defects and that there was no alternative to surgery. Throughout the entire encounter, he never looked at Luoxi once, let alone used a stethoscope to listen to her heart. He simply declared she had heart disease. Panicked, we paid a 10,000 renminbi deposit and admitted her. Still uneasy, we consulted staff at another hospital, who told us that while their equipment was for adults, the Ningbo Women and Children's Hospital was the leading authority for infants. We returned, firmly believing we had made the right choice. On the morning of the 12th, the CTA report was issued. The promises and hospitalization, November 12 to 13, 2025. During our consultation on November 12, Director Chen Junxian stated that Luoxi had a 3 mm atrial defect, a 7 mm unroofed coronary sinus syndrome, and pulmonary hypertension, making immediate surgery necessary. He claimed that even if we went to Shanghai, Beijing, or the United States, the diagnosis would be the same. Without surgery, she would face feeding issues, stunted growth, and intellectual disabilities. He described the surgery as a routine, entry-level procedure for congenital heart defects that would take about 3 hours and had a 99% success rate. He even claimed that if any issues arose, a temporary pacemaker would guarantee a successful outcome. The total cost was estimated at 60,000 renminbi, with insurance covering 80 to 85%. He warned that delaying the surgery would only increase the risk and difficulty later on. Trusting this prestigious hospital and the chief physician, and after seeing 2 successful cases he posted on Douyin, we consented to the surgery. During her 3-day hospitalization, November 11th to 13th, not a single doctor visited the ward, though they drew 8 vials of blood from her. On November 13th, there was still no communication from any physician. The day of surgery, November 14th, 2025. On November 14th, at 7:48 a.m., we handed her over to the nurses. She was taken into the operating room at 8:11 a.m. At 9:25 a.m., the monitor outside indicated the surgery had officially begun. By 1 p.m., we were growing anxious. We asked a middleman to check on her, and the word came back that the surgery was over and had gone very smoothly. We were so relieved. However, by 2 p.m., she still hadn't been brought out. While other patients' names cleared the screen, Luoxi's status remained in surgery. At 2:20 p.m., I confronted Dr. Yu Qingzhong. He claimed the surgery was difficult due to poor heart and lung function. I asked whether a temporary pacemaker had been used. He said it had not been used at that time, that the vital signs were stable, and that we should not worry. We continued to wait in agony. My wife called the hospital's public line 4 times for updates, but they were dismissive and never called back. While waiting, We stumbled upon a post on Zaya Hongshu about a fatal case from June 2025. It happened in the same operating room, number 12, under the same surgeon, Dr. Chen Junxian. The details were hauntingly similar, a promised 3-hour surgery and a 99% success rate, but the child died after 8 hours with the surgical wound still open. We became extremely panicked, though we tried to comfort ourselves by thinking that maybe this particular operation was especially difficult. All we could do was keep praying that the baby would come out safely as soon as possible. Whenever we saw medical staff or a surgical cart going in and out, we asked every single person we could. How is the smallest baby, the one who went into the operating room first? They all said they didn't know. It felt as if there was nothing else we could do. We were overwhelmed by a profound sense of helplessness. The 2 elderly family members already had a strong feeling that something might go wrong. At that moment, none of us even cared whether the surgery successfully fixed the heart problem. We only wanted the child to come out alive and safe. By 3:33 p.m., we were called to the surgical update window. Dr. Yu Qingzhong said the operation was basically coming to an end. He said it was a difficult procedure and a temporary cardiac pacemaker had been used, but the vital signs were good. We were also told the surgery would finish very soon, and that Director Chen Junxian would speak with us afterward. Mr. Chen Bo, a staff member from the hospital's doctor-patient relations office, told us that because the surgery was still in progress, he could not learn what was happening inside. He asked us to trust Director Chen Junxian and trust Ningbo Women and Children's Hospital. Our family asked to immediately bring in a more experienced doctor, even an expert from Shanghai at our own expense. We stated that we would not pursue Director Chen's fault, we only wanted the child to survive and be kept safe. Chen Bo agreed to communicate and coordinate with experts in Shanghai. At 4:20 p.m., in the surgical briefing room, Director Chen Junxian told us the baby's heart rate, blood pressure, and oxygen saturation were all good, but that the baby was very small and critically ill. He said the lungs were not doing well, the cardiac function was poor, and that the baby had received a 100 milliliters blood transfusion. He said a pacemaker had been placed, the unroofed issue was resolved, and the atrium had been repaired. He claimed that everything was currently stable. The baby's mother questioned him. The surgery had run far longer than the promised time. What exactly happened in the middle? Why was the actual process and timeline different from what was discussed before surgery? Why did no department come out to give any updates despite our repeated inquiries? Director Chen replied that the doctors were busy rescuing the patient and it was impossible to come out first to communicate with us. The mother asked, "I just want to know whether my child is in life-threatening danger right now." Director Chen responded that the risk was 50% in each aspect, and that whether the baby would survive depended on what happened in the PICU. He said the baby's heart and lung function were poor, and that the operation had taken too long. The cardiopulmonary bypass time was 335 minutes. He then took out his phone and showed us photos, saying that the heart function, breathing, and vital signs were currently good, and asked us to sign. We refused to sign. We thought, if this was a surgery you claim was successful, how could the survival chance be only 50%? We asked, didn't you say the success rate was 99%? Director Chen replied, that 1% happened. He also said low cardiac output had occurred, but that the surgery itself was successful and the vital signs were stable. He asked again for us to sign and we refused again. Director Chen then left in an agitated and irritable manner. There are video recordings of these surgical briefing conversations with audio. At the time, we requested that the hospital and police, together with family members, witness and seal the recordings for preservation. At 4:37 p.m., Luoshi was wheeled out of the operating room, and the family immediately recorded video. The PICU and declaration of death, November 14th night. After the baby was transferred into the PICU, at 5:35 p.m. our family requested to enter the PICU. After that, we continued waiting at the PICU entrance. Once she was in the PICU, we asked to go in and photograph the monitors so other doctors could see if her vitals were truly stable. After multiple requests, they finally let Luoshi's mother in at 5:35 p.m. The moment she stepped in, she saw our daughter's face was swollen beyond recognition. She was covered in tubes, and the constant beeping of the machines was a haunting contrast to the silence of the room. Luoshi's mother cried and whispered to her, "Luoshi, you have to be strong. Grandma and your other grandma are waiting for you outside." A tear fell from the corner of our daughter's eye. That sight was a devastating blow to my heart. I didn't even dare to wipe that tear away. We were ushered out about a minute later. We waited anxiously outside the piku. Shenbo came out again to soothe us. We kept insisting on the experts. He said he was communicating, but it required approval. He mentioned that Dr. Chiu, an expert from Shanghai, would be coming the next morning at the earliest, around 10 a.m. At around 7 p.m., I overheard a doctor on the phone saying a 5-month-old girl was in bad shape and needed a puncture. I told Luoshi's mother immediately. She then pressed the piku doorbell and demanded an explanation. The staff said they were performing resuscitation, but they still would not say clearly who exactly was being resuscitated inside. Luoshi's mother asked, "Is it my daughter?" The response from inside was only, "A doctor will come out later to communicate with the parents." They also said, "Stop ringing the bell. You're interfering with the doctor's work." At that moment, every last bit of self-deception and hope we had collapsed. Luoshi's mother suddenly dropped to her knees outside the piku, praying desperately to every god and Buddha she could think of, "Please keep my daughter safe. Luoshi, you have to hold on, you have to be strong. You cannot die. I bought you so many new clothes and you haven't even worn them. Just stay alive. Even if the anesthesia caused brain damage, we'll accept it. Just stay alive." At 8:30 p.m., Dr. Dong from the piku asked us to sign a blood work report, saying, "Look, these values aren't bad." My wife refused to sign. At 9:30 p.m., Dr. Dong told us to prepare for the worst. At 10:03 p.m., Dr. Dong announced Luoshi's death. Throughout the entire process, our family never received any formal critical condition notice. We immediately called 110. Dozens of police officers arrived. No matter how we cried and tried to explain that the child's death was abnormal, they only said, "We are only responsible for maintaining order." Luoshi's mother suffered a complete mental breakdown and repeatedly demanded to see her daughter. Our whole family was devastated. My mother and wife fainted. Not a single hospital staff member came to explain the true cause of death. We believe this surgery was completely abnormal. We demanded to see our daughter immediately, but the hospital blocked us in every way, claiming we were too emotional. My wife knelt and begged Dr. Dong and Director Yi, but they refused. Security guards even forcibly dragged her away, preventing her from seeing her daughter one last time. Another parent outside the piku fainted. They cried that seeing what happened to us made them feel their own child wasn't safe here. Director Yi later claimed our crying caused the other parent to faint. I'm clarifying this here, and the piku surveillance can prove the truth. Finally, after much pleading and emotional turmoil, they agreed to let her look through a crack in the piku door. She was allowed to say a few words to her daughter, but security guards covered her eyes and mouth so she couldn't call out her name loudly. Our entire family only asked for one thing, to see our daughter one last time. We were not granted that. We also immediately requested that the medical records be sealed and preserved, and demanded to see the lead surgeon so that he could explain what happened during the operation and what happened inside the piku. What exactly caused our daughter's death, and why we were not allowed to see the child even after she died. No matter how we begged, even kneeling, the hospital would not let us in. They would not allow our whole family to see her one last time. Overwhelmed by sudden disaster and grief, in utter sorrow and helplessness, my spouse, the grandmother, and I knelt on the roadside, begging hospital leadership to come forward and let us see our child. In the end, no one came out. Only the police blocked us. With no other choice, at more than 10 0 p.m. We continued to demand to seal and preserve the records immediately, and let us see the lead surgeon. We did not obtain the records until around 5 a.m. the next morning. The aftermath, November 15, 2025. After 5:47 a.m., we finally met Director Chen Junxian and someone the hospital described as a vice president. The vice president said that if we did not pursue the hospital's responsibility, they could offer compensation of 10,000 renminbi. In our overwhelming grief, we asked, "What will happen to our child's body now?" The hospital replied that after 6 hours they would forcibly transfer the body to the morgue. We stated, this was an abnormal surgery. The hospital insisted, the surgery was successful. It's just that Su Luoxi was not strong enough and died in the PICU. You can request an autopsy if you have doubts, but Luoxi had to be moved to the morgue within 6 hours. At the time, when Luoxi's mother and the grandmother heard the word autopsy, they strongly refused. We had already completely lost trust in the hospital and did not dare to leave our daughter there any longer. We then called the funeral home. It was not until around 9 a.m. that the hospital finally returned our daughter to us, on a small newborn trolley, placed on a diaper-changing pad. Only then did the hospital return our child to our family. It had been more than 24 hours. We then went to the Ningbo funeral home. Only there did Luoxi's mother finally see what Luoxi looked like after surgery. In freezing weather, she was not dressed, only loosely covered with a new surgical gown. Her entire face was darkened, her face was swollen, her body was already completely stiff, her small fists were tightly clenched, and her feet were rigidly pointed. Even more shocking, more than half of her body was covered in purple bruising, and there was intermittent bleeding from her nostrils. Our family is determined to pursue accountability to the end. No one should die in such a tragic manner. She was only 5 months old. She endured a 7-hour 10-minute operation, underwent 2 chest openings, and was under general anesthesia for 9 hours. Because of preoperative fasting, she went hungry for dozens of hours before and after, without a single sip of milk. After death, she could not even have her family by her side. She had no dignity at all. Before the surgery, someone told us to give a red envelope so the staff would be more careful, saying they had good connections and that everything had been properly arranged and that we could talk about it afterward. They told us to give a red envelope to the anesthesiologist because the child was so small. Through this intermediary, we gave 1,600 renminbi. After the surgery failed and our child died, the red envelope money was returned to the intermediary. Neither the intermediary, who was introduced as a friend, nor the anesthesiologist ever even subtly reminded us about the surgical risks. Nor did they mention that in June, Director Chen Junxian had allegedly caused the death of another infant. Online posts claimed there were 5 such cases in total.